Welcome and thank you for joining. My name is Ashley Lusick and I am a health educator for community health at Atlantic Health System. Today's webinar, HPV related cancers and the LGBTQ plus community, is presented by Ashley Perper and Chantel James. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or the chat for comments. We will try and get through all questions at the end of this presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources, or for any additional dates and times, please call 1-844-472-8499. I am now going to turn it over to Ashley and Chantel.
Yes, thank you very much. Just gonna now share my screen. All right, thank you. So again, my name is Chantel James. I am a community cancer control specialist here at Rutgers Cancer Institute of New Jersey. So a little bit about what we do. We work to educate the communities about cancer prevention, early detection, and my colleague, Ashley's going to be joining. So Ashley, if you can just introduce yourself for a little bit.
Of course. So hello, my name is Ashley Perper. I use she, her pronouns. I'm also a community cancer control specialist here at Rutgers Cancer Institute of New Jersey, and I'll be talking a little bit further down the presentation.
All right, sounds good. Thank you, Ashley. So just a little bit of a disclaimer for today that the information contained in this presentation is not for substitute for medical consultation. We are health educators and not a physician. So a physician should always be consulted for any health problems or medical conditions. Any logos or text or images used in this presentation, just to let you know, will be used for educational purposes only. And if you need any information from here, it will be from us and from our permission to use the information here. So just a quick disclaimer before we begin. So today's presentation, as you can see, is HPV and the LGBTQ plus community. So I'll be starting out with talking about what HPV is, basically laying the foundation, and then Ashley will come in and talk about LGBTQ plus community, terminology disparities. I'll also be going over understanding what cancer screenings exist, or get vaccinations, risk factors, and how to prevent HPV. And for the pretest, if we can get that to be launched, this is just to see what you already know about the topic. We're going to go back over the answers. So no pressure at all. So if you can go ahead and answer these questions while I read them. The HPV can be transmitted via intimate skin-to-skin contact, true or false? HPV vaccine can be taken to prevent HPV-related cancers, true or false? Some queer women delay or forego preventative care, true or false? And the last one says an estimated 70% of transgender, gender nonconforming individuals have experienced discrimination in healthcare, true or false? All right. All right, thank you so much. We just ended the poll. And then again, we'll give those answers towards the end, just so we can learn this information, even if you're not aware of these things. So I'm going on my next slide. So what is HPV, right? HPV stands for human papilloma virus. Human papilloma virus is the most sexually transmitted infection in the United States. And so this is a lot, right? Um, there are other different types of sexually transmitted infections. So for this to be the most common type of sexually transmitted infection, it speaks to the importance of this topic. Um, HPV can be transmitted via intimate skin to skin contact, that is by way of having vaginal, anal, or oral sexual intercourse. The virus can be spread also by genital contact without even having sexual intercourse. Also, other types of oral to genital or hand to genital spread for anyone that has had the infection can be passed to someone else if, these behaviors are involved. Another thing to also talk about is the fact that not just having sexual intercourse, but having other contact, which is the biggest piece of this. That intimate skin to skin contact is important to know when we talk about transmission. So HPV affects nearly all sexually active people, regardless of the amount of partners that they have or their sexual orientation. About 85% of people will have an HPV infection in their lifetime. So that's pretty common. And contrary to popular belief, practicing safer sex alone will not completely prevent HPV. So we'll talk a little bit more shortly about the most effective way, which is by getting HPV vaccine and other methods as well. But this is just a really good fact to note. And so when we talk about HPV, human papillomavirus, it's important to know that there are over 200 different types or strains. It's really also good to know that there are high risk types of HPV, and then there are low risk types. So in the top corner, you can see that, the types that are low risk are non-cancerous. These are the types that can cause warts on the body, especially near the mouth or the anus or the genital. Some HPV clears on its own by the help of your immune system, and normally that is what the low risk types of HPVs are. So just because if someone has HPV, doesn't mean that they have cancer. It may be also because they may have a low risk type that the body cleared out on its own, or maybe come up as a wart or something. The type to be concerned about is the high-risk types of HPV, which will cause cancer, like cancer of the cervix, cancer of the vulva, cancer of the anus, the mouth, the throat, and the penis. So these are the types that we are most concerned about, because those are the types that causes these cancers. What are some things that will put you at a higher risk? And we've highlighted some of these things that could put you at a higher risk for getting HPV. So there's some unique individuals that may have HIV, which is human immunodeficiency virus. A lot of people have heard of HIV, a lot more than they've heard of HPV. But the association is that people who have HIV, they're more likely to be exposed to the HPV virus because they're most likely taking medications that will suppress their immune system and weaken that immune system. So we want your immune system to be working well, and anything that is a threat to your immune system is not going to be clearing out those HPV infections. So that would be a risk factor. Also, smoking. So those who smoke have an increased risk of developing cervical cancer. Smoking can increase the risk of cancer from HPV infections. Another thing would be the number of sexual partners. Um, Obviously, if there is more sexual partners that you may or may not be involved with, then the likelihood of you getting HPV would increase. One thing to keep in mind is that you can also be infected by one person as well. Maybe if that one person is being safe or not being safe, or participating in sexually safe behavior, then that one person can also put you at risk. But number of partners is definitely also some kind of risk factor as well. Also, what we want to talk about, well, how can we minimize those risks, right? So if smoking and partners and weakened immune system, these are all things that will cause you to be at a higher risk, then, stop cutting out or say smoking cessation, stop smoking, try to see how you can, reduce those habits. Using protection can help as well. It is not the only way to prevent HPV, but it can help. Again, limiting the amount of partners that you have. And one way, definitely for sure, to prevent the HPV is to get the HPV vaccine, which I'll talk about later. Then, there are cases of HPV attributable cancers. This is just really good to show what cancers are at a higher rate at the time when this data was collected. The time it was cervical cancer, you can see in the yellow that the cervical cancer cases are really up there. And then the second highest amount of cases is the oral cases. So HPV is causing a lot of cervical cancer cases that we're seeing in the community, and also it's causing a lot of the oral cancer cases as well. All the other cases still exist, so there's still vaginal, vulvar, penile, and anal cancers. It's just not as much in number as it is for cervical cancer specifically and oral cancers. And just briefly, we're just going to go over some of the signs and symptoms for these types of cancers. Just keep in mind that these are that you may or may not have any sign or symptoms initially, but these are just some of the things that you want to pay attention to if they are abnormal. So let's say for cervical cancer, it may be vaginal bleeding, lots of pelvic pain. For vulvar, it could be lumps or growths that just won't go away, ulcers or warts that probably stayed there for a while. For vaginal, it's the same, bleeding, abnormal pain that you're experiencing. For oral, it would be trouble swallowing, maybe a long-lasting ear pain or sore throat issues. Now, just keep in mind, we're talking about abnormal things here. We're not talking about a regular sore throat or having a lump or wart that's normal, right, or goes away. We're talking about things that, you've experienced bleeding for over a certain amount of time that's abnormal for you. You've experienced trouble swallowing for a longer time than normal. So these are the concerns you want to bring up to your doctor, talk to your primary care or specialist about, just so you can make sure that you're taking care of your health. A lot of people have questions about where, these body parts are. If you have a cervix, this is just really good to show the internal body parts of where these cancers form. This is specifically on the left. The bigger picture shows the cervix, where the cervix is, shows where the vagina is. It shows where on the right-hand side, it shows a more external picture where it shows the vulva specifically. Wanted to show that because a lot of people may or may not know exactly what a vulva is or where it is. So you can see here where those different kind of cancers may develop. And so now I'm just going to talk about the HPV vaccination and the screenings. And as you can see in this picture, I really like this one because it shows HPV in the middle, and that HPV causes all of these cancers. The arrows are showing that HPV is the cause of most of these different cancers, exactly what we just talked about. A lot of people have questions about this vaccine and the safety of the vaccine and different concerns. So just want to let you know that the HPV vaccine is a cancer prevention vaccine. It protects against the 9 different types of HPV that are most likely to cause those cancers, those genital warts. So remember I talked about there's over 200 different strains of HPV. The vaccine specifically targets those high-risk types of HPV and, you know, does the job as it relates to targeting these specific types of HPV, the high risk specifically ones. And just want to let you know that preventing cancer is always better than treating it. This is a really great fact to know about the HPV vaccine is that it can prevent more than 90% of cancers caused by HPV. So if you were to get the HPV vaccine at the recommended age, you'll be getting 90% protection from all these HPV related cancers. And this is why this is important to note. Other concerns may be the safety. Just want to let you know that the HPV vaccine went through strict safety testing before the U.S. Food and Drug Administration and the CDC. It has over 15 years of monitoring and research and clinical trials. This has been out since 2006. So it's been out way before there are other vaccines that are current now, like COVID and different types of vaccines. But this is not something new. If you've heard of it on the commercial, it's, you would hear about Gardasil. This is what they're referring to. So just letting you know that this is not something new, but it's something that we want to continue to talk about because it can prevent those cancers. Now, for age recommendations, starting at the age of 11. So it's recommended at the age for all boys and girls for 2 doses between the ages of 11 and 12 over the course of a year. So you'll do over the course of 6 months and you do 1 dose, then you'll do the next dose. If you're over the age of 15, then it would be 3 doses in the course of 6 months. And then there are also, there are also catch-up vaccinations for people who have not gotten the vaccinations. So just keep in mind that it is recommended up until the age of 26. Now, insurance coverage and things like that may change after the age of 26, but it's still recommended for safety up until the age of 45. So you can still get the catch-up vaccine. It's definitely something you want to talk to your provider about making sure that, there are benefits to you getting it at this age, but you can get it up until the age of 45. And the great thing about that is that even if you get it at a later age, what you'll be doing is preventing the future the future exposures that you may or may not have. So that'd be good for you to get, even if you've passed that age. If you're over the age of 45, there are other things that you can do as it relates to cervical cancer screening. So we'll talk about that. So where can you get this vaccine? You can get it at doctor's offices. You can get it at community health clinics, school-based health centers, health department. This is a really good link to use. It's called localhealth.nj.gov for people who need to find their closest health department. You can put in your zip code. Once you put in your zip code, it will show you the name of your closest health department. It'll show their contact information. So you can go ahead and call your closest health department and they'll tell you where to get it in your area. That's if your doctor's office for some reason doesn't have it, but there's so many different places that you can get it. There are other programs. This specific program is called the VFC program. specifically for children to get that vaccine for free based on eligibility. Different things like age is a factor, your level of insurance, if you're uninsured or underinsured, they can definitely assist with that. So you can also ask your doctor about that or the health department about those VFC programs. Other things that you can do to, making sure that you're keeping up with your health is getting those pap smears. So I want to talk about the cervical cancer screening recommendations. So let's say you're over the age of 45, you don't have the vaccine or you're past the age to do so, and you still want to make sure that you're doing the necessary screenings to find out if there's any complications with your cervix. You can start at the age of 21 per the U.S. Preventative Service Task Force, and that's doing your pap smears every 3 years. So 21 to 29, then from 30 to 65, you can do a co-test. You can do the 3 years pap smears every 3 years, along with getting the HPV co-test as well. Sometimes the GYN will do them together. And then if you're over the age of 65, according to the U.S. Preventative Service Task Force, they normally would recommend against getting the cervical screening after the age of 65. But again, this is a general recommendation. It will still go by what your if you have any family history of cervical cancer or different things that may play a factor in this. So just keep in mind that there are other people who are over the age of 65 that could still get cervical cancer, but it just depends on your history and making sure that you're still having those conversations with your doctor after that age to make sure that you're, if you're done with getting those screenings, then, they'll advise. So then the HPV test is really good for us to just state that you can also get an HPV test aside from just the regular pap smear. This is where they'll just send back the results and look to see if there's any HPV strains. And then just to go in a little bit detail about the population that's over the age of 65, really quick. So a recent study found that some women do not continue to get screened after the age of 65 as they get older. But unfortunately, from the CDC, they're saying that you can still get cervical cancer when you're older than the age of 65. The only way to know to stop getting screenings is if you've been getting several tests, or if your doctor recommends based on your history, and you've been keeping up to date with your pap smears over the years. You want to make sure that it's cleared by your doctor based on your overall health to stop screening. If you're a person who have had their cervix removed or had a hysterectomy, you just want to keep getting tested until you're at least 65 years old. And sometimes we get questions about the pap smear and how does it work as it relates to testing for those HPV strains or testing for cervical cancer. So what they will do in the cervical cancer screening when you go to a GYN is they'll do an insert, and then they will do a slight swab of the cervix, and then they'll send that over to the lab. And what they're looking for is they're looking to see if there are any precancerous cells or cancer cells, right? That will tell them if there's any cervical cancer in your cervix or anything like that. And then, if you need to get a follow-up, you can go for a follow-up after that. If everything is normal, they'll let you know they haven't seen anything cancerous. You're cleared for the next couple of years. And so now that concludes my portion of the webinar, and I'll hand it over to Ashley, which will now talk about the LGBTQ plus population as it relates to HPV.
Great, thank you so much. So yes, we are going to talk a little bit about the HPV disparities we see in the LGBTQ plus population. But first, I just want to take a few moments to cover some LGBTQ plus terminology, just so we are all on that same level of basic understanding of some of the things we will be talking about. Next slide, please. So first, let's talk about the acronym. What do these letters mean? What is this alphabet here? So the LGBTQ plus acronym is really an umbrella term used to describe all sexual and gender minorities. The term queer is sometimes used interchangeably with this acronym. You may hear me kind of pop back and forth between that. But first, let's talk about each of these letters. So the first letter of the acronym is the letter L. This stands for lesbian. Someone who identifies as lesbian is someone who identifies as female being attracted to other people who identify as female. Then we have the second letter is the letter G. This is for the word gay. Someone who is gay is someone who is attracted to members of the same gender as their own. Most of the time, the term gay is used to describe men who are attracted to other men, but it can be used to describe women who are attracted to other women. Again, it's just being attracted to those of the same gender as yourself. Then we have the letter B. This is for bisexual. The term bisexual is used to describe someone who is attracted to members of the same gender as themselves, as well as other genders. Again, this is a good indication of how language changes and evolves over time. The term bisexual used to just mean someone who is attracted to men and women, but it's starting to get away from really that binary of men and women and really just means attracted to people of the same gender as your own, as well as other genders. Then we have the fourth letter, which is the letter T. This stands for transgender. The term transgender describes someone who does not identify with the sex they were assigned at birth. For example, a transgender woman is someone who was assigned male at birth and identifies as female. On the other hand, a transgender man is someone who was assigned female at birth and identifies as male. The fifth letter in the acronym is the letter Q, which stands for queer. And the term queer, again, is really just used to refer to anyone who is not straight or not cisgender. Again, it's really that umbrella term used sort of interchangeably with the LGBTQ plus acronym. I do want to point out that the term queer can seem controversial. It has been used as a slur throughout history, but there's really been a lot of work done to reclaim the term. And another thing I just want to point out that even within all of these population groups, there is diversity based on race and ethnicity and age, socioeconomic status, geographic location. You can even belong to more than one of these identity groups. You can be transgender and lesbian, transgender and gay. You know, it's really not just lesbian, gay, bisexual, trans. Like you can be a member of multiple groups. Next slide. And you may not know all the terms, that's okay. LGBTQ plus people use a variety of terms to describe their identity and to talk about who they are. The most important thing is to just listen, pay attention to how people are talking about themselves, and then mirror their language. We really just want to respect that self-identification. Most of the time, the acronym is written with this little plus sign at the end. And this plus sign is used to represent really any other sexual or gender identity not included in that L, G, B, or T. I have some examples here on the screen of what the plus can represent. We have pansexual, asexual, demisexual, agender. You know, we could, I'm not going to go too far into what these terms mean because I mean, there are over like 100 different terms and we would be here for the next week really trying to describe all of these. But just again, understanding that this plus can represent really any sexual or gender identity, and again, just respecting that self-identification. Next slide. So now I just want to take a moment to talk about the difference between sex assigned at birth, gender, and sexual orientation. Again, it's really just to get everyone on this same basic page of understanding. So when we talk about disparities, you have sort of a frame of reference. Next slide. So when it comes to really understanding these, we want to talk about the difference. So first, your sex assigned at birth is really just a label that your doctor gives to you when you are born, really just based on anatomy and medical factors. So if your doctor writes M on your birth certificate, that means you were assigned male at birth. If they write F, that means you were assigned female at birth. Now, gender is someone's innermost concept of self as a man, a woman, a blend of both. or neither. Again, your gender identity can be the same as your sex assigned at birth, or it may be different than your sex assigned at birth. And your gender is really an adjective, not a noun, especially when it comes to the transgender community. You would say a transgender man, transgender woman. You wouldn't say like a group of transgenders or someone transgendered last year. That it's really that adjective. And finally, your sexual orientation describes who you are attracted to, whether romantically, sexually, emotionally. This is a spectrum and can vary throughout a person's life. Next slide, please. So now we're really going to dive into the health disparities we see, mainly HPV. This is a major disparity that we do see in the queer community. Chantel did a great job at describing what HPV is, so I'm not going to go too in detail into what it is. But some things I want to point out is that an estimated 61% of HIV negative and 93% of HIV positive gay and bisexual men have anal HPV infections. And this is really compared to about 50% or less of heterosexual men. Only about 25% of gay and bisexual men are knowledgeable about the relationship between HPV infection and anal cancers. I also want to point out that queer women are less likely to visit and utilize those preventative health services. They're less likely to go to the OBGYN to get tested because a lot believe they are not at risk for STDs, STIs, because they are not having that heterosexual intercourse. So they feel they're not at risk. But women who have sex with women can contract this virus and all other STDs from an infected partner in the same ways that straight women can. This includes genital to genital contact, touching the genitals of a partner and then your own, or even just sharing of sex toys without properly cleaning them first. And I do want to note that a lot of queer women have also experienced straight intercourse at some point in their life, which also increases their risk for HPV. But again, lesbians are less likely to regularly visit a reproductive health specialist and are therefore just less exposed to information about HPV overall, or less likely to make use of those preventative steps developed for women to protect against HPV. Next slide. And as Chantel also pointed out, HPV can lead to several different types of cancer, and the LGBTQ plus community is disproportionately affected by cervical, anal, and oral cancers. Again, many queer women delay or forego proper preventative care and screening just because they believe they are not at risk for developing STIs, HPV. But again, women who have sex with women can contract the virus from an infected partner really in all the same ways that straight women can. Men who have sex with men are also at an increased risk for anal cancer when compared to the general population. And again, since the HPV virus is easily transmitted through skin mucosal contact, oral sex is a potential vehicle for transmission. And HPV does play an independent role in the development of about 30% of oral cancers. LGBTQ plus individuals are at a higher risk for HPV infection, thus making them at a higher risk for developing certain cancers. And again, what can you do? There is an approved vaccine to help protect against the most common strains of HPV. Next slide, please. So LGBTQ plus people do face many factors that contribute to these health disparities. They face a lot of barriers to care. There are many factors that can contribute to the health disparities as highlighted in this graphic. We see queer populations have higher rates of homelessness, lower rates of proper health insurance. LGBTQ plus populations do have higher rates of smoking, alcohol, and other drug use. A lot of these behaviors are due to the added stress and as coping mechanisms that go along with being considered a minority population, such as discrimination, prejudice, and stigma, often from peers, family members, and really the overall community. One major contributing factor is the potential discrimination in the healthcare setting. It has been noted that many LGBTQ plus individuals delay or forego going to the doctor due to fear of discrimination, or just a lack of culturally competent providers. And delaying or not seeking preventative care can lead to undiagnosed disease or receiving a diagnosis at a later stage of disease when it becomes much harder to treat. One jarring statistic, according to the National LGBT Cancer Network, is that 60% of oncologists feel they do not know enough to properly treat lesbian, gay, and bisexual patients, while 80% feel they do not know enough to properly treat transgender patients. Next slide, please. This is really just an image that displays some of what I was just saying. We see that 56% of lesbian, gay, and bisexual people that responded to this survey had at least one experience of discrimination when seeing a physician. We see that up to 70% of transgender or other gender nonconforming people that responded have experienced discrimination and barriers to care in the healthcare setting. And 63% of people living with HIV have experienced discrimination in healthcare as well. Next slide. So I know we talked a lot about HPV screening for cervical cancer, barriers that some populations may face. I do want to take a moment to talk about some free services in New Jersey that can help people navigate this confusing system. So here at Screen NJ, we do have a patient navigation team. Our patient navigators are located all across the state and can assist community members in getting those cancer screenings that they need, while also helping them address any other barriers they may have to receiving those proper cancer screenings. Next slide, please. In our state, we also have the NJ Seed program. It is a program run by the New Jersey Department of Health in collaboration with local agencies and healthcare systems. The NJ Seed program provides education and outreach within the community about different types of cancer. They also provide free screenings of different types of cancer, such as breast, cervical, which is mainly important for today's discussion, colorectal and prostate cancers. And they are for those that are unemployed, underinsured, or uninsured, or just face overall barriers to getting cancer screenings. There is at least one NJC program in all 21 counties throughout the state. Next slide, please. So we've made it back to our post-test, which is everyone's favorite part of any workshop. These, I'm going to launch the poll in just a second, I think, if I can. All right, great. It should be popping up on your screen. These are the same true false statements that we launched at the beginning. So if you could just take a moment and fill this out, then we will talk about the answers. So statement 1, HPV can be transmitted via intimate skin-to-skin contact. Is this true or false? The HPV vaccine can be taken to prevent HPV-related cancers. True or false? Some queer women delay or forego preventative care. True or false? And finally, an estimated 70% of transgender and gender nonconforming individuals have experienced discrimination in healthcare. True or false? Oh, it looks like, oh, great. Everyone has already responded. That was probably the quickest I've ever seen people complete the poll, which is great. Let me just end it real quick. It looks like everyone got all of the answers correct. All of the statements are true statements. You know, HPV can be transmitted via any intimate skin-to-skin contact. It doesn't necessarily have to be that penetrative sex that we typically associate with STDs and STIs. There is an approved vaccine that can be taken to help prevent HPV-related cancers. Many queer women, queer people in general, will delay or forego preventative care. And an estimated 70% of gender nonconforming individuals have experienced discrimination in the healthcare setting. Let me stop sharing this poll. Let's see. And I believe we can go on to the next slide, which is just our evaluation survey. So we do have an evaluation survey that we do ask everyone to complete. It'll take maybe a minute tops. It just helps us improve our programming going forward. So you can scan the QR code, or I'm dropping the link in the chat.
I would like to say thank you for joining us. We kindly ask that you take a few minutes after today's webinar to complete the program survey. The link to the survey has been added to the chat for your convenience. A special thank you to Ashley and Chantel for dedicating your time and expertise today. If you have any additional questions or comments, you can send an email to communityhealth@atlantichealth.org or call 1-844-472-8499. Also, we have the information here shared from Ashley and Chantel as well for their contact information, and I will be sending out an email shortly with further information as well. That concludes today's webinar, and I hope everybody has a great day.